And we're live, I think.
Hi, and welcome to today's edition of FlareVet. I'm your host today, Bill Tancredi. Dr. Gonzalez is going to hopefully join us later, but he's otherwise occupied. I'd like to introduce all of our panelists today. We have Dr. Nick Ray, who founded a veterinary AI company before he had his DVM, built VetBrain to power the phone, answer the phones, and uh, practice his clients every day, building in public, documenting the failures too. Respect that for sure. Chris Tremblay is the founder of Practice Experts, working the AI automation analytics angle for Animal Hospital. He runs the SEO for my hospitals, does a fantastic job. One of the reasons I'm so busy. Uh, we have Greg Bishop, DVM, who's published on stranded harbor seals and rhino granulomas, current title as the world's foremost veterinary cartoonist, teaches and lectures on the use of humor in clinical communications. Um, then we have Dr. Mark DeWald, founded 5 hospitals, a pharma company, a regional emergency co-op, and now the CVO at Nervex, Kingston's Business Person of the Year, and by far the most overqualified person in the room. And then we have our guests. Pietro Cabella went from renting self-balancing scooters to founding FairVet, one of the first vet price transparency platforms. He will pitch you on it in French, English, or Lingala, from what I read. Uh, and Suzanne Cannon, who co-founded Vet Billing 13 years ago, a on the idea that decisions belong to veterinary teams, not lenders, coined the financial triage. She is an unapologetic access to care activist, and vet billing is a service that we use at my hospitals here in Pennsylvania. So welcome, guys.
Thank you.
Thank you.
Um, my first question, and to get us started, is to ask uh, Pietro about FairVet. Tell us what it is and um, what you hope to accomplish and what inspired its creation.
So yeah, I'm Pietro, the founder of FlareVet. So FlareVet, it's the first price transparency platform for price clarity. The reason why I built FlareVet, it was from a personal situation. So I almost lost my dog King when he swallowed a foreign object one day. And just like any pet parent, it was an emergency. So I went to the first vet that I found online. And just going there and doing a few exam, I already racked up 800 in vet bill before they found out that it was where the foreign object was located. So I was given a 24 hours estimate for an emergency surgery for foreign object. That surgery will cost me was about to cost me $2,500 at that time, which was totally unexpected. So I was given 24 hours to decide if I wanted to go forward with the surgery. I went back home. Couldn't. I was trying to find something that was in my range at that time. So I started searching online. It was kind of hard, and in the morning I started doing some calls, and it was very very difficult for me to even get an estimate just from. It will cost you around $100 to, let's say, even $1,000. And at that point, I got lucky. I was able to find one clinic that was able to do the surgery at $1,700 for that same surgery that I wanted, which I was able to save at the time. And at that moment, that's when I started digging into the problem and learning about price transparency, lack of price transparency, and the cost varying from each clinic. So that's when I started FairVet.
Thank you. Uh, and Suzanne, can you talk a little bit about vet billing?
Yeah, sure. So there's definitely some overlaps with Pietro's experience as a pet owner and vet billing. Vet billing was also started based on a personal experience that happened almost 20 years ago, where I have had schnauzers since I was 10 years old. So they're kind of the poster children for pancreatitis. Even if you have them on a prescription diet and whatever. So, of course, on a weekend, I have a schnauzer that's 8 who gets acute pancreatitis. at night on a weekend. So we end up at the ER. And I've been through this before, so I know the usual course. What had changed for me was, as a pet owner, I was going through a vulnerable time in my life. So I was in the midst of a divorce. And then I suddenly found myself facing like a $4,000 vet bill. And it kind of makes me laugh to think that by today, that actually sounds like kind of a bargain for how many days she had to be hospitalized. I had pet insurance. I got pet insurance in the 90s when there was only one company. But what I learned from that situation was my pet insurance doesn't help because you have to pay the bill first and then you have to file a claim for reimbursement. And back then, reimbursement turnaround times were a lot longer than they are now, like weeks to months. So I didn't have that resource. I didn't have $4,000 available immediately. And the very kind and empathetic receptionist at the emergency said, well, don't worry, we have this thing called Care Credit and you can apply for it. I was so relieved. Okay, all right, we're going to be okay. And then I was declined for Care Credit. And at that moment, I felt I felt embarrassed and humiliated because I didn't understand why I was declined. Keep in mind, I didn't really know much about credit at this time, even my own. And I wasn't familiar with Care Credit at that time. And so what ended up happening, how the situation got resolved, was I turned to my mom, good old mom. So what mom did was she put up the 4,000 and I did a payment plan back to my mom. And that was kind of the seed that planted the idea of vet billing many years before it actually turned into an idea. And since then, we've grown into we launched in 2013, late 2013. And since that time, we've developed a complete payment management platform that allows vets and pet owners to have an alternative to third-party financing, which is based on credit scoring, and gives an alternative, especially if you have, say, a longtime client that needs financing, but they don't qualify. So our platform allows veterinarians to offer in-house payment plans, but we manage the entire process from beginning to end. So you log into our platform, you have pre-designed contract templates. We can customize those. You can determine the terms for payback period. How long does the person have, maybe based on the balance amount. And then once you click submit and send that to vet billing, we handle everything from there. All the customer service, payment exceptions, payment recovery if someone happens to go into default. And we also do other things like allow vets to do creative things like offer pay in advance plans for surgeries or procedures that can be scheduled ahead that aren't urgent, like, for example, dentals, which
sure, a TPLO or something that's not an expensive procedure that doesn't need to happen today.
That, and you can set up pet savings accounts for your clients if they're like frequent flyers and they want to put away money in advance. They can either save it up or kind of use it as they go. We manage wellness plan payments, any kind of membership or subscription type of recurring payment we can manage. So we do have some clinics that offer unique sorts of programs. Like we have one clinic that allows clients to do payment plans for Bravecto quantum injections because they're quite expensive. Okay. So they set up a template to allow people to spread that cost over time.
Okay. I obviously think it's useful. The next perspective I'd really like to invite, because I think, is the newly minted Dr. Nick Ray. Like, I think what you're taught in school, not that you have like a ton of clinical experience yet, but I really invite that, because Mark has a bunch of clinics. A lot of them are GPs. Greg has a lot of experience as an emergency doctor. I think, trying to be fair to everyone and like setting financial guidelines is hard. Owners need predictability. They need comparability. Clinicians need the estimate not to become a contract that constrains care. staff need to not be the ones absorbing a surprise. The practice needs to not eat scope creep, one like to itself. Surprises land on owners, caps land on patients. Like, how is this addressed in Missouri, right?
Tennessee.
Tennessee, I'm sorry.
Yeah.
Like, how is this addressed at UT?
To be honest with you, it's really not talked about much through school. Estimates we work up in clinics, but it's not something that we're ever taught or really expanded upon in any class through didactic. And I think a lot of new grads are put into these situations in clinics where they're adopting these fee schedules with no real defensibility or understanding of why they're charging what they're charging. So I think it's a daunting task for new grads to take on, just price transparency in general. So
there's not a lot. Greg, how do the clinics you work at address it? Not hearing you. I'm sorry.
I'm so surprised that like the thing that you spend so much time doing in your professional life is still just not really brought up in school. Like,
Sure.
I don't know. It's just blows my mind that they don't focus on this. It feels so important.
Yes, we
for
spend a
me,
lot of time doing this.
Yeah, I mean it's well, the whole clinical communication thing is just like a tiny fraction of the education. But anyway, I mean I'm technically I'm a relief vet, so I work in different areas. So they kind of have their whole system. Sometimes it's very formalized. Sometimes it is we are going to lay out like exactly line by line the estimate. We're going to go through that before we do anything else. Sometimes it's an informal thing. I mean, for me, it feels like even if it's informal, even if the client says, I don't care, I don't want to hear about the numbers before we do this, like I've been burned way too many times.
Sure.
to just like go run with it. Like I go, I'm so sorry, just for my own sake, I want to make sure that like I've set the expectations appropriately, because money is one of the major factors in conflict and in what you can provide. It's like it just unfortunately is it determines what we can do. So you really have to have the conversation. Doctors need to be comfortable having the conversation. It's great if you have a charge coordinator or somebody that can go over the estimate, but I do feel like doctors have to be able to understand what it's going to cost, to understand what the client's expectations are, and that all has to be determined beforehand, at least have a sense of it.
Yeah. Mark, how do your clinics, like, do you have standard protocols for this across your hospitals, or how do you address it?
I think it's really funny because, one of the jokes that we have is that when a client says that money is no object, it usually means money is the object. And I find that so frequently that when a client portrays that sort of sentiment, that's usually the client I'm going to give a little bit more time with. And I don't think it necessarily is a cost thing that we need to be more concerned about. I do think it comes down to the communication thing. There's an equation that we sometimes use, and that is that the value somebody receives is the benefit that they're getting divided by the price. And I think you can probably break down that equation a little bit, because the price, we can kind of refer to this cost, this cost that we're unaware of as a client. And the benefit, I think we know as clinicians what the patient might benefit from. We're the professionals. We're the ones that are providing this particular advice. So I think that that's really clear. But we need to somehow convey that to the client. So that's the communication part. The communication part is, how do we communicate that to the client in a way that they can understand that? We can bring some clarity to that discussion. And most importantly, it needs to be a shared decision-making process. I think that that's part of it too. And I'm using the word decision quite loosely, because if I'm using the word decision, I'm implying that there's more than one choice. And there's always more than one choice. So I think that we always have what we think is the best choice first. As clinicians, I think we owe that to our patients to bring the best choice forward. But I think we also have, the obligation to hear a client, to meet them where they are, and then to provide them with opportunities for decisions and decisions that they can make, because we're providing them with the education to make sure that it's a decision they're comfortable with. And then all of a sudden that value thing comes into play. Then all of a sudden it's like, okay, now I get it. Now I get why this procedure is going to cost this much, or why this particular situation is going to be that much more expensive. And maybe I can't afford that. But that allows the client the opportunity to engage with us back and forth so that we can find something that both parties are feeling good moving forward with.
I agree with you, and I think one of the studies that gets brought up a lot, I think it was a PetSmart Charities Gallup poll about how like 75% of veterinarians responding to it said they offered payment options and different tiers of pricing and that sort of thing, and 75% of clients said they'd never heard that before in their life. They'd never received that, and I'm off with the numbers, but it is in the 70 or 80% range or something, and both of those things can't be true. So like, what are we not getting across to clients? What are they not hearing? Are people not hearing us in a stressful moment, right? Or are we thinking, yeah, we did that, didn't we? Like, where there's an obvious and pretty significant disconnect there. And maybe Suzanne can speak to that, because you've talked about this a lot.
Yeah, if you don't mind, I would say one of the things is that I find in talking to lots of practices is, like, those who work in and around veterinary medicine, we know what payment options are available, and we care credit, like, oh wow, that's been around for 30 years. Clients are not as familiar with that as all of us are. And I can speak to this from being a client who didn't really know what care credit was when I was in an emergency situation, and then from shadowing at clinics. So as much as, like, a lot of us think it should be obvious to clients that financing is available for veterinary care, a lot of your clients don't know. I often don't see a lot of client education around payment options. Like, a big missed opportunity, I think, is on-hold messaging. If you've got on-hold messaging, I hear everything about your clinic. I might hear your veterinarian's bio. I might hear about heartworm preventative, extended hours. I never hear about convenient payment options, or did you know that you can spread the cost of your care over time? Right now, clients are looking for that. They want the information. So I think veterinarians can be much more forward about doing passive education, meaning post about it on your social media regularly. Hey, did you know we offer multiple options for financing care? And these are the things that help with affordability. Talking to clients about it. I mean, I know a lot of clinicians worry, well, I don't want to get caught up in all of this conversation. It doesn't have to take long. And you can set it up so the communication happens at multiple touch points throughout the clinic journey for the client. But clients they really don't know. And you're right, Dr. Tancredi, that when they're stressed out or worried or scared, your executive function is a bit impaired. Like, you can't necessarily accommodate high emotions with logic. And so they may be missing what you said, which is why I believe so strongly in kind of the passive education, social media, in-clinic signage, in-clinic brochures, mention it on your intake forms, like really talk about it and let clients know that's available, so that when they come in and they're an emergency, maybe they've been sitting in your exam room before, when you take their dog or cat out and they're sitting there and they're maybe looking on their phone, but at some point, maybe they're looking around the exam room and they see a poster that says, pay for care over time. Even if all they're doing is sort of subliminally taking that in, I think it's really, really important. And that's part of what I call being a financially friendly practice, conveying that. That doesn't mean cut your prices or be a discount clinic. It means be really forward in presenting, making your clients aware. And I'm not in the clinic, so I don't know how burdensome that might feel to a clinician or not, but it's just something that I see sort of repeatedly. Often payment options aren't even on clinics' websites, or if they are, they're often hard to find. And it's really, really, I think clients are looking for that. They really are looking for that information.
I think you know, a year ago, or like before I started using the ambient AI scribes, I would have disagreed with you. Like, no, we do this, we present it. But I think the background conversations, you know, I couple of like a month or two ago, I had a patient and I was looking for at the transcript we have for it because I was looking for something specific that we talked about. And I realized when I had left the room, the clients had a really intense conversation with the owner of the dog on the phone about like, you need to get here, you need to pay for this. When I said, do you need an estimate? Do you need anything? Like, they're like, no, go do everything you just recommended. Go for it. Like, we're good. And then the door shuts and they are arguing, like the whole family's involved in the conversation. So I think we as veterinarians have to acknowledge that we don't always, like, we're not always, like, it's not always our fault that we don't know this, but we don't always know what's going on with the clients, and being told one thing and having another happen is a reality. So that ambient, like that background, like more passive ways of presenting payment options and flexibility and that kind of thing, inviting the client to get there is, I think, is very, very important for us.
Can I add one more thing really quick that ties into
Sure.
what you just said? And having done some of my shadowing at clinics, because I have a close friend that owns a local clinic here, and I would just shadow because I was kind of researching workflows, how clients, I would observe clients as the vet was talking to them about what was going on, and the potential maybe kind of casually talking about a cost before presenting an estimate. And some of you guys know my previous professional life was as a counselor. So, and I did a lot of couples counseling, which was really horrible, by the way. Don't ever do that. It's like the hardest thing ever. But what I would do is I would kind of watch the veterinarian. I would watch the clients. In this particular case, I'm thinking of, it was a couple. And this was October. So it was a few months before Christmas. And what I saw was this was not an inexpensive thing that they were talking about. My recalls was about $700 for whatever it was. Not, you know, nothing to sneeze at. And they looked really kind of wide-eyed at my friend, the veterinarian owner of this practice, and they just kind of nodded. And then she left the room with the pet to do blood work or whatever it was. And I stayed there. And I asked them, I engaged them in a conversation. I said, so how did this land for you guys? You know, your concern about what's happening and the cost. And long story short, they didn't know anything about care credit. It didn't occur to them to ask if there were payment options. They had a conversation between themselves about, oh, well, we had this budgeted for Christmas. I guess we can forget about that. We can't do that now because we have to deal with this. They didn't know they had options. And also, I will say that because you guys, as the vets, are really the authority figure in the room, you kind of hold the power. Clients oftentimes are almost afraid to bring this up with you first. They don't want to be judged. They don't want to feel embarrassed that they're worried about money. This is not everybody, of course. This is a generalization. But that a lot of times we as the client are sitting there and we're scared poopless about, number one, what's happening with our animal if they're sick. And then secondarily, oh my gosh, what is this going to cost? To invite those clients in to a conversation about that by saying, now that we've talked about this, what concerns do you have about budget or affordability today, if any? You don't want to prejudge them, but some kind of line that can sort of just invite them in so they know that it's safe to talk about it. Okay. And I'll be quiet now. I just wanted to give you a little bit more of the client perspective about what's going on. That stuff is super easy for a vet to not be attending to because you're attending to the animal. You're thinking through differential diagnosis. You're thinking through all sorts of things. So you wouldn't necessarily pick up on cues or interpret silence as perhaps fear of bringing something up, and especially if they're nodding at you. Like, yeah, this is fine. Oh, that doesn't always mean like, yeah, it really is fine. But a lot of times they're a little bit afraid to bring things up. And we all know money comes with so much baggage anyway, psychologically. It's difficult for both sides of the table to deal with this issue. And I'd love to see it get easier for everybody. with just a few extra communication skills.
So
Yeah.
I mean, my pushback would be like, so now we have to be responsible for not only the pet's health, but also the client's financial status. And I kind of resent that as a veterinarian. Like
Yeah.
there's a way to invite the conversation like, hey, do you need an estimate? They say no, then I go to work. I don't know about everybody else, but
Well,
I'm
I
Greg.
I would just and I'm going to push back on the pushback, so we'll have a pushback circle here, but like if you think about the relationship, it's the quality of the relationship with your client that ultimately delivers the quality of medicine to the animal, I believe, right? Like, and that doesn't mean that you can't fire clients, it doesn't mean that clients won't be difficult, but like if your end goal is quality medicine to the animal, like, yeah, it does require the ideal relationship means, yeah, we're on the same page. We feel like you're getting the value out of it. I feel like I'm providing the services we agreed upon. So I think that like it's just part of medicine. It's not like, the animals aren't coming in with a unlimited credit card on their own. Like you have to do this because let's say that client gets upset about cost, or like they were nodding but they didn't understand what was happening, and then you're going to go provide services, but then the trust that you have with that client's going to erode. Like I think it matters. You don't have to be perfect at it, but I do think you need to consider it part of medicine, like that you're
Sure.
providing.
Yeah, I guess my pushback is not like I is more like I kind of take them at a yes, right? Like if they've got an estimate or something, like I don't dig deeper than that, and that is maybe that's a failure of communication, but I also think it's like a way of when I'm from the East Coast, right? Like we're pretty direct, pretty straightforward, right? Like, and I'm famously so even by East Coast standards.
Yeah.
So
Yeah.
I tend to believe people when they say things to me. Like, are you good? They say, yeah. I'm like, okay, and I assume you're good, and maybe that's not the right way to go about it.
Well,
But I
yeah.
take your point, right? Like building that relationship is um, important. Maybe Nick can speak to what that looks like what it looks like for you in your first week of clinics.
So I've only worked about 2 shifts. Yeah, 2 shifts now. And so I feel like I'm not the most versed when it comes to this topic as a whole in general. What I do know from my generation is that if I tell any friends or people that I see out that I'm, a veterinarian, it is the first thing I hear is, oh, bills are so expensive. And I think that comes from a lack of awareness as a whole when it comes to prices and different options. Like you were talking about, Suzanne, I think we as veterinarians in school are not taught these kind of ways to go about payment plans and reducing prices and making it easier for both clients and veterinarians. But I don't think it's talked about enough. I don't think this topic is talked about enough. Prices, as we know, have risen, skyrocketed over the last 5 years alone. And I don't know the ultimate solution. I like what Mark said as well, that educating clients on why we feel like we need to do what we do. And so they feel it's more of a team effort, that we're doing what's best for these pets that we're treating. It's a tough topic. And, I feel that I don't know where I stand with all of it just because I'm so new and I haven't had to have these tough conversations as the veterinarian just yet. So I am excited to kind of give my viewpoint as time goes on.
I think they're all a little different, right? Like there's times when um, I don't think every client interaction is the same, and I think it's your perspective is a good one because you're like, there are clients who've had this conversation with veterinarians more than you have had it with clients. Um, two shifts in, that's probably true, right? Um, Regarding the rising cost of care, and Suzanne and I talked about this, like I do think one thing that doesn't get brought up enough is that we are way better at medicine than we used to be, right? Like even 10, 15 years ago, I look around, I'm like, wow, we are constantly improving. So I do think, the standard of care has risen. I think outcomes have improved. So I don't think we get, I don't think we give ourselves enough credit for that, because that creeps up, and prices rise because we're using, everybody's getting a catheter, or everybody's, we've got, better Tomcat catheters than the red rubbers we used 20 years ago, right? Like I, and the Tomcats are more expensive. So I do wonder if there was a way, like there was a metric about that. And this actually brings me to my question for Pietro, which is, by, you know, FairVet, right? Like price transparency across different hospitals, amongst competitors. Most economics books will tell you that like that won't make prices cheaper. That'll make prices more like each other, and they tend to go upwards. So are you worried about that happening with FairVet? Are you worried about like the prices creeping up? Like the famous like Danish, what is it, construction or Danish competition committee, the cement, right? Like no, it wasn't, it was concrete back in like the early 90s. They found that like by publishing the prices, those prices
Mhm.
crashed.
Really interesting.
Yeah. So, of course, that's something that may happen in terms of veterinary clinics going into competition with each other. What we do understand in terms of pet parents, it's more that we don't need the exact cost on everything, right, in your menu. But what we need, it's almost an understanding before going in, even just an average cost, right? Uh, okay, this is going to cost around this certain amount, right? This is how much it costs, around 2,500. We don't need the exact cost. At least when I come in, I know, okay, that's the maximum that it may cost for this exam. Maybe it would fall at 1,300, but at least I know how much I need to bring in. My problem, it's mostly that we go inside vet clinics and we have no idea how much it's going to cost, but zero. We don't even, so most of the pet parents that I speak to or they reach out is that they have zero idea on exam, dental. So it's a total, they get blindsided every single time they come in. So that's where we want to make the difference. It's just that instead of being blindsided, at least you know an estimate of, okay, this is around how much it costs, right? So you go in better informed, and there's less friction inside the clinic when you arrive.
You'd actually be sending people to the clinics where they prefer to go, rather than people feeling stuck in a clinic, because it's hard to have options once you're there. It's hard to say, oh, wait a second, like I'm going to need all this stuff, and that's the only price you have. Well, like, gosh, I wish I wish I knew that beforehand. I might have gone to a lower cost clinic. And there's a whole spectrum of care here, but if we're not triaging people into the right lanes, like, there is going to be friction, like you're talking about.
Exactly. It's the same thing as going dining. I always use that example. It's going dining, right? Sometimes you don't have the money to go to a fancy restaurant, even if they offer better food, better quality, they use better ingredient, but you don't have the budget to go there, right?
Yeah.
So with your budget, you have to go to a different restaurant to go dine. So that's what we want in terms of people going in clinics, that they have the proper budget, or at least they understand how much it would cost if they want those better instrument that the vets are using, better care. But at least they know when they arrive, okay, this is what I'm getting, and this is why I'm paying this extra amount to get this type of service.
I guess my worry about this is like everybody has like kind of a pretty good idea of like the difference between like 11 Madison Park and McDonald's, right? Like everybody like has a like not everybody has a concept of why the SPCA charges $200 for a spay and I charge $1,000 for a spay, right? Like, does the SPCA meet? Like, I don't try to do a spay as cheaply as possible. I try to do it as well as possible. Right. Like, and the same thing for dentals, for splenectomies, for everything, right? Like, that is where like people are going to start solving just for cost. And it's like, well, if you knew a little more, right? Like it might be worth an extra $200 for anesthetic monitoring, right? Like we didn't use, we didn't sedate with, what did the old guys use? Like ACE and atropine, right? Like maybe we used reversible agents, maybe we used better pain control, maybe we used nerve blocks, right? Maybe we had, so, the cost of a dental, like, oh, it's $1,500. It's like, yeah, we took x-rays. The guy down the street charged $600, didn't take x-rays. Like, I think that's like, are we going to, this is what I mean about having that conversation about the better quality of care, right? Like I do certain things that, and it makes me look smarter, but it's not smarter. Like we do cystos to collect urinalysis, right? Better medicine. I get a look at the bladder. I get all that kind of stuff. Like, so I worry about just saying, here's the prices, pick the cheap, like sort by lowest, and not including more detail than that.
We do, because we have a vet that's part of our team, and he's been part of the Mars doctors. And one of the things that he's helping us, because we had this conversation when he got on board, right? And he told us that people need to understand what the value that they're getting inside what they're paying for, exactly as you're saying. And that's one of the things why our messaging turned into more clarity, right? Into understanding what you're paying for. And in terms of that, we don't have any problem on putting, so we're adding tags, right, on what you're getting and the estimate or the cost that you're seeing. So a certified board surgeon and so on and so forth. So we're adding tags that goes along in the amount that you're seeing, why it's this amount that you're seeing in this estimate for this type of service. But as I said, is that we have to work with vets to make the best product as possible, right? But the thing is that I understand it in terms of pet parents. I do understand that inside of that clinic, it's a totally different ball game, and how you guys present it and what you guys are doing. You guys want us as pet parents to understand, okay, this is the value that you're getting. But at this moment, there's a friction on, we're not totally understanding what we're getting, and it's just creating frustration, right? We're just receiving that vet bill or go inside the clinic and we're receiving, okay, this is how much you have to pay. And then at that point you get stressed out, right? Because it's money. Then you start doing some math. And
you're doing math in your head, trying to figure it out. And I would say a lot of times what happens too psychologically is the money, the number obscures the ability to take in additional information and to understand nuances and care. So I think this is it's a tough situation. Like, I feel for you guys, because I just went through my mom having a presumptive stroke, a posterior stroke 2 weekends ago. And Greg, I chatted with you about this a little bit on LinkedIn, because you posted about how frustrating it is for pet parents to deal with uncertainty, and yet you're trying to convey there is no certainty about this. And we kind of hate it. And as a patient, as the family member of a patient, whether it's human or it's animal, I'm kind of sitting there in fear mode. I just want my mom to be okay. I just want my dog to be okay. And I'm sitting in the emergency room with my mom. And the other thing to take into consideration is varying degrees of health literacy among clients and patients. So I have the advantage of having worked with vets, having been a counselor, having worked in a hospital setting. So I'm like familiar with some of the terminology, but I'm still having to sit there and listen to an ER doctor say to me, okay, so we suspect your mom's having a posterior stroke. We don't think it's a vestibular migraine or vertigo. I can't tell you that for sure, but here's what I recommend. I'm leaning toward that's what this is. We can give her a clot busting thrombolytic drug called tenecteplase, and you have to give it in 4.5 hours or it's not effective. But here's the risk: life-threatening bleeding. And she's like, the risk is low, but it's not zero. It's about 6%. I'm in a state I'm in a state of fear. I'm looking at my mom and she looks like horrible and I'm worried she's dying. She's 83. Like, you know, my sister works in a hospital too. She's a pastoral care director. But even that familiarity with the terminology or whatever, I don't know, your decision-making skills are sort of distorted or impaired at moments like that. So
I don't think it should be your decision. I mean, I like something like that. Like, I think the ER doc's got to tell you, like, hey, this is the best thing to do. And I know it sounds paternalistic, and I know it sounds like all kinds of ways, but expecting to me, expecting the client to like order off the menu and pick the options based on what they can afford is nuts to me, right? Like expecting that level of like medical literacy is madness. Like
well, you got
to me,
what about
say,
informed
give me a number
consent?
and I will do the most good I can for that number.
You need to recognize where people are. Like there's some people where we're just telling them what to do is going to go horribly wrong. And there's some people where giving them a range of options without emphasizing one or the other is going to go horribly wrong. Like, but to Suzanne's point, number one, I hope your mom's doing okay. And also
she is
like,
now. Thanks.
Thank goodness. It also, like that is a very real thing. Like people are, the emotions are high. Like I work in a lower cost emergency room where we are like, hey, I need to know in the next 90 seconds if you're willing to pay $500 to $1,000. I have to figure that out right now. And it's an extremely delicate conversation and it's extremely urgent. But like this is where all the communication skills come into play that make these conversations smoother, and they're always difficult. Like I tense up immediately. I'm like, oh my God, I got to go talk to these people. I got to find out quickly. It's impossible, but it is really important that we don't avoid that as clinicians. Like we don't avoid the discomfort of going to talk to people about money or like figuring out people's money situation. And it comes with everything else. It comes with presenting the options. It comes with finding out what the people really want and reading between the lines and all that stuff. I just think that the transparency about pricing, it's critical because because the vast majority of people are paying out of pocket, even if they're getting reimbursed with insurance. Like we have to find out from them, what are they willing to pay? Not in a exploitative way, not in a purely transactional way, but just what can I do medically with this patient? What kind of range, what kind of options do I have? I do think like that's what spectrum of care is. It's meeting people where they are and finding out how much leeway do I have with you and with your pet, and also do all the medicine in your head as you're having these conversations. I mean, I just think it's absolutely part of it.
Yeah, I think it's complicated, and I don't give orders, I give advice, right? Like, you know, when I present stuff, it's like, hey, it's like gold standard, bare minimum, and what I think you should do, right? Like, but when people have cost concerns, you know, it's like, oh, I've got $500 to spend, and this is what I want to spend it on. It's like, tell me the outcome you want and the money you want, and I will help you get there. Right? Like, rather than, I hate when, you know, people ask for an estimate and they're like, we want to do this test, and this test. I'm like, that is a waste of time. Like, you should tell me, we should not, like, I did that with a client a couple of weeks ago. I'm like, and I interrupt. I'm like, this is a terrible way to do this. Tell me what you want to spend and the outcome you want, and I will do the math. I will make the algorithm work. But
I love that.
You guys having that, like, expecting that level of literacy for clients is like, boy, that's not going to work. I can't imagine that working unless like I'm in Portland and I brought a cat to Greg, right? Like then a similar level of medical literacy is appropriate. But like otherwise, I think that's why I think we'll like give advice, not instructions. And I do I do appreciate the price transparency, but man, the same, like, foreign body surgery isn't always a foreign body surgery, right? Like, the one that's the linear foreign body that's perforated is really fucking different than the dog that's got a tennis ball. It's a simple gastrotomy, right? like one single stone is going to take me less time than a spay and on a cystotomy. But if there is like a gravel truck in that cat's bladder, it's going to take me longer. So it's going to be harder. Recovery is going to be harder. It's going to cost more money, right? And these can be $1,000 difference in price. And I don't always know that until I actually open a patient, like, oh, or until I take an x-ray, right? A blocked cat can be, 2 minutes at like sedate and unblock and have a lovely day, or a blocked cat can be 3 days of hospitalization. And like,
Well,
it's hard to, so I think it's hard to get that level of, as a guy who struggles with communication sometimes, it can be hard to get that level of clarity across to a client.
It really is. It is.
What about,
so
like,
I want to say,
yeah.
Sorry, go ahead, Greg.
No, I just
go ahead, Greg.
Go ahead.
I wanted to say, Bill, I think there's something you hit on in there though that I think is super good. When you said it, what you said to your clients, tell me how much money you have and tell me what outcome you want, and I'm going to help you get there. Listening to that as a pet parent, I felt relief because you kind of took charge. And you also said that was a very collaborative thing to say. It was like, we're in this together. Here's your money. Here's what you want. I'm the vet. Let me take it off you. Let me help you figure out how to get there. That's one of the best things that I've heard from somebody who is a self-proclaimed poor communicator, which I don't think you are, but because that was sort of like you took charge, but you weren't intimidating. You were like, hey, this is our thing to solve together, and I'm going to help you get there. And I spoke to you briefly last night about the difference in equine vet med, because I have a horse, and small animal vet med. Those kind of conversations are always front and center with my horse vets because they come out personally. They hardly ever collect payment at the point of care. Budget is always woven through the conversation. And my vet has said things to me like, yeah, we could do this test and this test, but I don't want to spend your money that way because I don't think it's going to change how we approach treatment or what we do. So there's like a lot of candor there, and it feels like an alliance, the vet and me, the horse in the middle. I would say that small animal vet feels less like an alliance anymore because the money gets in the way and it starts to feel transactional. And that's partly because we've divided it. I saw
it is a transaction. I mean,
it is, but we're talking about wanting people to accept what you're doing so that you can do it. And there's no way around this. This sucks. It sucks. It sucks for you guys. When I was in the hospital with my mom, I'm like, these doctors have the luxury of coming in, dealing with the medicine, talking about what's going on, and they leave. There's no discussion about money. That they're lucky that way. That isn't how vet med is. Unfortunately, that is not the system that we're dealing with. And it's frustrating because it requires skill sets from you guys that some people either A, don't have, B, don't want to have, C, doesn't come naturally to you. But it's really tough to deal with.
And it's not selected for, right? Like, nobody asked Nick in his vet school interview, like, hey, are you a really nice person? Can you talk to people? Like, by the way, that's like 80% of the job we're training you to do. Like, we're not selecting for it. Like, you're culling resumes and applications on GPA first, and it's like, good luck. Like, we're not looking for the stuff that 70+% of the veterinarians in the United States do most of their time.
Nick, have you in your 2 days of clinics, have you had any financial conversations with clients at all?
No, not yet, luckily. But no, I mean, Bill, what you just said, what I've realized in 2 shifts as the doctor, I don't know an exact percentage, but I've been saying about 80% of it is being able to effectively communicate, which for a lot of people, or most people, I think it comes either natural or not. And if you're able to relate on a deeply personal level with your clients, the overall process, not just about price, but why you want to do what you want to do for their pet, is so much more effective it really is the biggest portion of the job is being able to communicate.
Sure, absolutely. And we're coming up at the end of our time here, and I mean, I feel like this conversation could go on for days, but I do think this is, I think the access to care conversation is important. I think it's important because I think preventative care saves a lot of really expensive emergency care, right? I opened an urgent care because I thought there was an in-between space between Greg, your job as a tertiary care facility, maybe not a low-cost ER, but like a tertiary care facility, is to be the last line of defense, right? Like it is set up to be like, you best not miss, right? Like I can be like, well, we can be conservative. The ER vets aren't in that position. And, I'll take, a lot of responsibility for the care of animals, but I do think some of it's on the clients too, right? Like if you haven't been to the vet in 3 years and you're upset about the cost of care, like maybe this stuff could have been caught earlier. Not if you were like hit by a bus, but like your cat's dental abscess and you've had stomatitis for years, like, yeah, maybe we could have done something about that. Like, so I do think the part of the conversation, like this is only part of the conversation, because the other part of the conversation has to come, not just from Pietro and Suzanne, who are trying to help the access to care, but and Chris, but like from the pet owners.
Yeah, I mean, I do think I think you want a smorgasbord of access to care solutions. I mean, I think that's like, to me, like at the place where I work, it's a 24-hour facility. We probably unblock 2 or 3 cats a day here. And I'm not even kidding. And like, we are, it's a few $1,000s for us to hospitalize the cat and do all that stuff. At the other ERs, it can be $8,000 to $10,000 to unblock a cat for 48 hours, 72 hours of inpatient care. So I'm like, look, like there clearly this town has a lot of cats that are blocking. Like, yes, some people are going to avoid it. Some people literally don't have $2,000 to $3,000 to cover that cost of care. Like we do flush and goes, we do decompressive cystos when we have to.
Treat and street.
We'll euthanize cats at times because it's like the access to care is a major problem. But I'm like, there are creative solutions. Like decompressive cystos was not something I saw done up until a few years ago. And it's like, there's going to be some cats where that works for them. So I think just like yes, the pet owners, like ideally, yes, we put the burden on them, but like that's not going to work. Like people are going to have pets. Poor people are going to have pets. People without housing are going to have pets. Like it is our job in the immediate sense to provide care, but also in the broader sense as a community to be creative and come up with options. And Suzanne and Pietro are part of that solution. So I do think it's like it's not all binary. It's not all this and that.
No, it's
very
complicated.
All of this whole field.
I agree completely.
I feel
I'll
for you
open the
guys.
floor for the last few minutes of our everybody want to get some last thoughts in?
I'd
Suzanne,
like to
you
make
started
a
to talk. I'm
comment.
sorry. Oh, go ahead, Chris, please.
Just from a client perspective, I don't think a great job is done with messaging for informing people what the cost of ownership for a pet is. Like, it's great you've got kids at home and you want to bring a puppy home because you got it for free, or your friend gave it to you at a discount, without realizing that you have a responsibility as a pet owner for, and it may be 15 years, but understanding just an overall perspective or a rough average or estimate or something of what the cost is for supporting the health and well-being of that pet without just going into it blindly. And I don't see a lot of messaging about that in the industry for pet owners.
Mm-hmm.
Well, there's the Care Credit Lifetime of Care study. The question is, who's getting the information?
Right. How are we getting the information in front of, potential pet owners?
And sadly, I don't know how much it would make a difference.
I don't know if it would either.
Yeah. I mean, so I'll say something like, it's going to make me super unpopular and I'm probably going to go out of business now. which is that I think some of you guys really want the ideal client. Like, I get that, the frustration of working with clients who have really limited information, low health literacy, all this. You deal with so much humanity in one day. So your job isn't even just the animals, you know, but there is no ideal client. There is no client that's ever going to be perfectly educated, that's going to understand value, that's going to be financially prepared and have a rainy day fund or enough credit. We're all broken in some way. Your clients. And as long as I think we keep wishing for better clients, we're going to be endlessly frustrated in practicing veterinary medicine. I think there has to be an acceptance that this is hard and that you're in this. So yeah, I don't mean to offend anybody by saying that, but because I recognize it in myself when I'm being constantly frustrated because I want this person to be this way and they keep not being this way. And I'm like, okay, who needs to adjust here? Me or them? And it doesn't have to be all, and I'm not saying it's got to be all on the vets. But I'm just saying it's like part of it is just a global general greater acceptance that clients are not going to walk in the door being the way that you want them to be financially or any other way. And so what do we do to mitigate as best we can on the veterinary end, on the clinical end, on the team end, as far as passive education and things like that? I just think that they won't be perfect, and it is frustrating. It's a lot. From the counselor perspective, I feel for you because I went to graduate school and I didn't know squat about communication, about tracking people. I learned it. It got drilled into my head in 3 years of graduate school. You guys don't get any of that. And it's a complicated dance that you're doing with clients and their pets. You're balancing a whole lot. So I have a lot of empathy for you. I think both sides need to get a little bit better at it, but I don't know how much expectation we can have that clients are just going to know these things. Pietro's app is a great step towards transparency and like not having pet owners be blindsided. Like you walk in and, you know, it hits you. But one more personal example. My shelter
actually, I'm going to stop you, Suzanne, because we're almost out of time. Can I ask
Oh, sorry.
Pietro and Nick for
Okay.
some final thoughts here? Pietro, anything you want to share with us before we go?
No, so my final word is basically, hopefully we find something between pet parents and vets for us to understand what we're getting into before going to the vet. I think it will be valuable for both parties to basically find, especially right now, since the cost of everything is going up, inflation, and pet parents are not going to the vet. I think it's such an important time for us to truly understand like how we can work together on helping those that are not doing the regular checkups, are just scared of the cost before going in, for them to understand, okay, this is what I have to pay before going in, basically. Thank you.
Yeah.
Thank you.
Yeah, I can add something real quick. I mean, I think just to echo what Suzanne and Pietro said, I think education across the board is lacking from veterinarians to pet parents with the responsibility of owning a pet and everything that goes into that. So I think there's ways to make this issue, which is, as we've been talking about for the last hour, quite a broad issue, more of a circular conversation between everyone involved. And if there's a way we can come up with resources and educational tools to better fit everyone involved, I think that's something that we need to work towards as a profession as a whole.
I agree with you, and I think I disagree with Suzanne very strongly on this because I don't think I want better clients. I think I have really good clients, and Nick, I'll tell you this: like the people who come back to you more than once and come back to you again and again are good clients. Like, you know, even if they, you know, you don't hang out with them personally or you don't, you know, you know, your personality or their personalities don't get along, like if they trust you with their animals, they're good clients. I believe that very
I
strongly.
didn't.
Uh,
I think I missed the mark in what I said then. Yeah.
Um,
Sorry about that.
so
I know
I
we're
mean,
out of
I
time.
think I have, I think I have good clients, and I think, what we don't talk about because it's really hard to quantify is the level of trust between um, the vet and the client. And if you've got that level of trust between each other and you've got that standard of communication, then you've got a good client, you've got a good vet. And I think that's at the heart of it. More educational tools, more opportunities um, for candid conversation is good. Um, but the trust between the vet and the client, that has got to come, first through fifth, I think. But thank you guys for your time today. I will sign off. Next month, your regular host John will be back. I hope to talk to you all soon. Take care,
you.
guys.
Thank you, Bill.
Bye.
Thank you, guys.